Hello, today we're going to do a presentation on healthy lungs and COPD. My name is Miranda Kiefer. I'm the community health worker out of the Norfolk office. And with me is
Katie Yonker, the community health worker out of the Niobrara office.
So let's get started. We're going to talk about healthy lungs first, and then Katie will do a little presentation on COPD. So healthy lungs. Your lungs are part of the respiratory system, a group of organs and tissues that work together to help you breathe. The respiratory system's main job is to move fresh air into your body while removing waste gases. So why are your lungs important? Every cell in your body needs oxygen in order to live. The air we breathe contains oxygen and other gases. Once in the lungs, oxygen is moved into the bloodstream and carried through your body. At each cell in your body, oxygen is exchanged for a waste gas called carbon dioxide. Your bloodstream then carries this waste gas back to the lungs, where it is removed from the bloodstream and then exhaled. Your lungs and respiratory system automatically perform this vital process called gas exchange. And then also your lungs, they bring air to the proper body temperature and moisturizing it to the right humidity level. And also protecting your body from harmful substances. This is done by coughing, sneezing, filtering, or swallowing, and then supporting your sense of smell. So we have, we have different parts of the respiratory system. And so we have the airways, which can consist of your sinuses, your nose, your mouth, your throat, and then your windpipe that is in your throat, and then also your bronchial tubes. And then we have the lungs and blood vessels, and in those is your lobes, then your cilia and your mucus, your bronchioles, your capillaries, your pulmonary artery, and then your pulmonary vein. And then you also have the muscles and the bones. So you have your diaphragm, which is the strong wall muscle that separates your chest cavity from the abdominal cavity. And then you also have your ribs, which are your bones that support and protect your chest cavity. And then they slightly move to help your lungs expand and contract. So then there's also how you can protect your lungs. There's different ways to do that. So like a couple examples would be non-smoking. So cigarette smoke is a major cause of lung cancer and chronic obstructive pulmonary disease, which is COPD, which Katie will later explain and go into depth on. And then also you want to avoid exposure to indoor pollutants that can damage your lungs, such as radon and other chemicals in your household or workplace. And then you want to minimize exposure to outdoor air pollution. And the air quality outside can vary from day to day and sometimes is unhealthy to breathe. So, if there's wildfires, climatic change, that can affect your lungs when you're breathing that in. And then you also want to prevent infection, such as a cold or respiratory infection, because they can become very serious. So as a reminder, always wash your hands, avoid crowds during the cold and flu season, which is right here with us now. And we do have our flu shots available in the clinic, so give us a call. And then also another thing is to have good oral hygiene, and then also get regular checkups, and then we can do exercise as well. So exercise, how does that strengthen the lungs? When you're physically active, your heart and lungs work harder to supply oxygen to your muscles. And so regular exercise makes your muscles stronger, and it also makes your lungs and heart stronger. So what types of exercise and how much? So the national guidelines recommend that all adults get 30 minutes of moderate exercise 5 days a week. So like walking, recreational biking, gardening, even vigorous house cleaning, which that's how I get mine, people. It is, whew, let me tell you, be breaking out in the sweat, not even planning on it. And then there's also another preventative, which is vaccines, which, like I said, we have our flu vaccines. So how does a vaccine work? There are several kinds of vaccines, and some contain the same germs that cause disease. However, the germs have been weakened or deadened, and others contain either a harmless part of the germ or its genetic material. And then a vaccine stimulates your immune system so that you produce the same antibodies that you would need to help fight that disease off. And so different respiratory diseases that have vaccines available would be, we have the COVID-19, influenza, pneumonia, tuberculosis. We also have the whooping cough, and then RSV, respiratory RSV, and then the common cold. And then we also have symptoms, different types, of lung diseases. There's a whole plethora. So like we're gonna go into COPD with Katie. And then we have asthma, which is one that I had printed out about, because that's a more common one in our youth and our elders. And we got sports for the youth and everything, and climate change. So we have some risk factors for asthma. Would be a combination of genetics and exposure to certain elements in the environment. And then there are several types of medicines available to treat asthma. And everybody's asthma symptoms is different, asthma case is different. And then the asthma, its most common symptoms when your asthma is not well controlled include the tight feeling in the chest. We have a shortness of breath, coughing and wheezing. And it's important to recognize these signs. And asthma causes is the understanding the experience or exposures that make your asthma flare up. And that's a key step to better managing your asthma. So like a lot of people in sports or something, they have to have their inhaler available. Anything that really gets those lungs working and gets out of breath a little bit to help them control that. Then we also have pneumonia. It's a good time of the season where pneumonia is prevalent. So pneumonia is an infection that inflames your lung air sacs. And the air sacs may fill up with fluids or pus, causing symptoms such as a cough, fever, chills, and trouble breathing. So the pneumonia symptoms can vary from mild to where you barely notice them to severe, where hospitalization is required. And then the signs and symptoms may include a cough, fever, sweating, shaking, chills, shortness of breath, rapid, shallow breathing, sharp or stabbing chest pain that gets worse when you breathe deeply or cough, loss of appetite, low energy, fatigue, nausea, vomiting, and then confusion. And then how pneumonia is treated, you go to the doctor for the diagnosis. It depends on the type of pneumonia you have, how it will be treated, and how sick you're feeling, your age, and whether you have other health conditions. But the goals of the treatment are to cure the infection and prevent complications. So there are medications that can be prescribed to you for that. And then we also have the flu or influenza. So the flu symptoms, what are they? They often appear suddenly. People are at higher risk of complications, such as those with chronic lung disease, and you should seek proper medical help. And then some symptoms of influenza, they can include sudden onset high fever, headache, muscle aches or joint pain, coughing, usually a dry cough, sore throat, nasal congestion and runny nose, and then fatigue, and then also stomach symptoms such as nausea, vomiting, or diarrhea. And then most people recover from the flu within 1 or 2 weeks, but others, especially the elderly, may feel weak for a long period of time after the symptoms go away. And then also the flu symptoms in children, school-age children and adolescents are similar to those in adults. They tend to have high temperatures ranging from 103 degrees to 105 fever. And so then what causes the flu? We have flu is caused by influenza viruses that infect the nose, throat, and lungs. And these viruses spread when people cough, sneeze, or talk, sending droplets with the virus into the air and potentially into the mouths and noses of other people nearby. So that's where you want to always wash your hands, wipe off surfaces as much as you can to help prevent those. And then some flu risk factors. We have chronic lung disease, such as asthma, COPD, and then we have heart disease, chronic kidney disease, diabetes, morbid obesity, severe anemia, and liver disorders. And then that can be treated with many medications. As I said, we also have the vaccine for that as well. And then we have like warning signs of lung disease. So your body gives you clues when there is something abnormal happening with your lungs. The symptoms may start out mild and you might consider dismissing them, but getting checked out can help you receive treatment before anything becomes too serious. So signs and symptoms of lung disease differ based on the disease, but for the most part they include a cough that lasts longer than 8 weeks, shortness of breath that doesn't go away after exercise, chest tightness, coughing up mucus or phlegm for a month or longer, wheezing or noisy breathing, unexplained chest pain, and coughing up blood. So any of these symptoms that you have or signs that you have, early detection is the key to, getting treatment and getting everything underway. So talk to your doctor as soon as possible. Go get it checked out. It's better just to do it in case than, wait too long. And then last but not least, on my part, there are plenty of procedures and tests and treatments you can do to help with lung disease. There's a bronchoscopy, which is a technique used to look at your air passages with a small camera that's located at a flexible tube, end of a flexible tube. There's a CT scan, which is a test that uses a series of computerized views taken from different angles to create detailed internal pictures of your body. There's also the exhaled nitric oxide test, which can help diagnose and manage asthma, which I speaked on before. It measures the amount of nitric oxide that is exhaled from a breath. Increased levels of the nitric oxide are associated with swelling of the lung airways. So that's why that one's important for that. And then some people may need a home oxygen concentrator. And there's also getting started with liquid oxygen and how to use it and care for your device if that is something that you need to help treat your lung disease. And it goes on and on about different types. Getting started with oxygen and metal tanks, that would be hooked up to the nostril tubes to breathe air through that to help assist you so that you're getting enough air in your lungs to expand them and contract them as needed so you're not struggling. And then, in the most severe cases, there's a lung transplant, which is a very serious procedure, and it's important to learn, more about it, and that's something that you, of course, in that way would talk to your doctor, because that, would be a very severe case if you had to go that far to get a lung treatment. And then all this information that I'm reading, and I'm sure a lot of it that Katie's going to be reading, is located at the American Lung Association. We will have the link provided with this video. So with that being said, if you have any comments or questions, please put them in the comments, and we'll get them answered as soon as possible. but I'm gonna turn it over to Katie so she can do a little bit on COPD for you guys.
Thank you, Miranda. So what is COPD? COPD stands for chronic obstructive pulmonary disease. It's a chronic inflammatory lung disease that causes obstructive airflow from the lungs. The symptoms of COPD include breathing difficulty, cough, mucus production, and wheezing. It's typically caused by long-term exposure to irritating gases, particle matter, most often from cigarette smoke. And then people with COPD are at an increased risk for developing heart disease, lung cancer, and a variety of other conditions. COPD affects millions of Americans and is the third leading cause of disease-related death in the U.S. So what are your symptoms of COPD? COPD symptoms often don't appear until significant lung damage has occurred, and they usually worsen over time, particularly if smoking exposure continues. And then some signs and symptoms include shortness of breath, wheezing, chest tightness, chronic cough with mucus that may be clear, white, yellow, green, different colors, and then frequent respiratory infections. And Miranda had kind of talked about some of those before, and then the lack of energy, unintended weight loss, and then swelling in your ankles, feet, and legs. And then people with COPD are likely to experience episodes called exacerbations, during which their symptoms become worse, usually day to day, and persist over several days. And then causes of COPD. So causes of airway obstruction, so that can include emphysema, The lung disease causes destruction of the fragile walls and the elastic fibers in the alveoli, which are small airways that collapse when you exhale and impairing the airflow. So this is when you can't exhale all that carbon out of your lungs. So, and then chronic bronchitis is a condition where your bronchial tubes become inflamed and narrowed, and your lungs produce more mucus, which can lead to further blocked and narrowed tubes. You can develop a chronic cough trying to clear your airways with chronic bronchitis. And then cigarette smoke and irritants. In the vast majority of people with COPD, the lung damage that leads to COPD is caused by long-term cigarette smoking. But there are likely factors at play in the development of COPD, such as genetics to the disease, because not all smokers will develop COPD. And then other irritants can cause COPD, including secondhand smoke, air pollution, workplace exposure to dust, smoke, or chemical fumes. And then another cause of COPD is the alpha-1 antitrypsin deficiency. And about 1% of people with COPD, the disease is from a genetic disorder that causes low levels of protein called alpha-1 antitrypsin, which is made in the liver and is secreted into the bloodstream to help protect the lungs. AAT deficiency can cause liver disease, lung disease, or both. And then for adults with COPD related to AAT deficiency, treatment options include those that are more common types, and then risk factors, exposure to tobacco. The most significant risk factor to COPD is long-term cigarette smoking. The more years you smoke and the more packs you smoke, the greater your risk. And then another risk factor is people with asthma. So asthma is a chronic inflammatory airway disease, which may be a risk factor for developing COPD. And then occupational exposures to dust and chemicals, long-term exposure to chemical fumes, vapors, and dust in the workplace. And then exposures to fume from burning fuel. So in the developing world, people exposed to fumes from burning fuels such as for cooking and heating in poorly ventilated homes are at higher risk for developing COPD. And then genetics, the uncommon genetic disorder alpha-1 antitrypsin deficiency is the cause of some cases of COPD. So what are some complications of COPD? Respiratory infections, so people with COPD are more likely to catch colds, the flu, and pneumonia. And then, as Miranda said, we do have those vaccines available here at the clinic. And then some other complications would include heart problems. So COPD, again, can increase your risk for heart disease, including heart attacks. Lung cancer, COPD. People with COPD have a higher risk of developing lung cancer. High blood pressure. COPD can cause high blood pressure in arteries that bring blood to your lungs, so pulmonary hypertension. And then depression. Difficulty breathing can keep you from doing activities that you enjoy and dealing with serious illness that contribute to the development of depression. And then seek immediate medical attention if you can't catch your breath. If you experience severe blueness of your lips or your fingernail beds, or a rapid heartbeat, or if you feel very foggy and you're having trouble concentrating, these might be some complications of COPD. And then prevention. Unlike some diseases, COPD typically has a clear cause and a clear path of prevention. And there are ways to slow the progression of the disease. The majority of the cases are related to cigarette smoking, and the best way to prevent COPD is to never smoke or to stop smoking now. And then if you are a long-term smoker, these simple statements may not seem so simple, especially if you have tried quitting. It's critical to find a tobacco cessation program that can help you quit for good. And then this will help reduce the damage to your lungs. Occupational exposure to chemical fumes and dust is another risk for COPD. So if you're working in these types of environments, it's important to talk to your supervisor about the best way to protect yourself and your coworkers, such as using respiratory protective equipment. And then here are some steps you can take to prevent complications. So to quit smoking, get an annual flu vaccine or pneumonia vaccine, and then get your regular, vaccines to prevent infections. And then talk to your doctor if you feel sad, helpless, or you're experiencing any depression, because this may be a sign that you're not getting enough oxygen to your lungs. And then how is COPD treated? So a spirometry is the most common type of pulmonary function or breathing test. The test measures how much air you can breathe in and out of your lungs, as well as how easily and fast you can blow air out of your lungs. So treating your COPD can greatly improve your quality of life. Your treatment options that your doctor may consider include quitting smoking, avoiding tobacco or air pollutants at home or at work. So again, those air pollutants can be in your home. So it's important to, like if you're using cleaning supplies, to make sure you have a window open, and then to get your air vents cleaned regularly. And then, so some other treatment options would be medication. So symptoms such as coughing or wheezing can be treated with medication. And then pulmonary rehabilitation, a personalized treatment program that teaches you how to manage your COPD symptoms and to improve your quality of life. Some plans may include learning how to breathe better, how to conserve your energy, and then advice on food and exercise. And then avoiding lung infections. So lung infections can cause serious problems with people with COPD. Certain vaccines can help. And then you can learn more about vaccine recommendations, respiratory infections that should be treated with antibiotics. And then supplemental oxygen from a portable oxygen tank if needed, if blood oxygen levels are low. And that was everything I had. And then I got that information from the CDC and then the Mayo Clinic as well. And so all of these can be included or referenced on the post. And then again, if you have any questions, just comment them below. And just remember, this is a public platform, and so anything you post is not private. So please try to keep your comments within our HIPAA regulations.
Thank
Thank
you.
you.